Hello, this is Gina Dita Donahue, founder of Blue Willow Precision Medicine. I am a nurse practitioner, an anti-aging provider, and now a student of mitochondrial health. Many patients come to see me and they ask me about hormone replacement therapy, and they want to know, what is it and is it safe? And I would rather talk to people about hormone balancing because HRT is a big buzzword right now, and it really suggests that there's one way of looking at a person, and that if we put you on hormone replacement therapy, somehow that's a single individual intervention that's going to solve all of your problems. And you are not just a body walking around with hormones. So I really don't like talking just about HRT, because to me, it is an oversimplification of your biology and keeping you as a well-functioning living creature. So when I talk to people about symptoms and about balancing hormones, I have to know who you are. We have to talk about your childhood and your past and your stressors, your environment, your lifestyle, your diet. How much do you move? How well do you sleep? What do you eat? Because all of these things impact the signals that are being transmitted throughout your body. What are hormones? Hormones are just messengers. Each hormone carries very specific types of signals to very specific receptors in your body. So what kind of signals are needing to be sent? How are they being sent? How are they being received? Are they being received well? Are they being misinterpreted? These are the kinds of things that we want to try to understand when we are talking about balancing hormones. So in a previous video, I talked about menopause and perimenopause, and these are certainly phases in a woman's life that are defined by very significant changes in hormonal fluctuations. So does that woman potentially need some help by taking some outside recommended substances such as hormones to help get her body back to balance? Potentially, yeah, that might really help her. But we have to first understand how is she experiencing these changes in her body. The same with men. I see many men who come to me feeling like their testosterone levels are off. Okay, well, testosterone is an end product. Estradiol and estrogen, these are end products. Do you have the precursors? Do you have the necessary ingredients to make these end products? So these are the kinds of questions that I like to talk to people about when it comes to balancing hormones. And again, I really just don't like using the term HRT. So do I ever prescribe hormones to people? Yes, of course I do, as part of an overall comprehensive plan. Are hormones safe to take? It depends on your body. That is a very individualized question to answer. So my answer to people when they ask me, is hormone replacement therapy safe? The question is, yes, it is, and no, it's not. It depends on you. You are the answer to that question. And maybe no, it's not at this time, but maybe it could become so in the future. Again, we can't just simplify your body into such black and white, yes and no kinds of answers to these questions that are overly simplified. So there's a lot of hormones being prescribed today by people who just simply plug your information into some kind of an algorithm or protocol or recommendation, such as something from the USPTF, the United States Preventive Task Force. And they just take your information, plug it in. Oh, you're this age. Oh, you have these symptoms. I'm just going to give you this. Next. That approach is always unsafe in my opinion, for any type of medical care, particularly with hormones, because you can have some very devastating side effects from hormones if they are not provided to you in a safe, personalized way. So when you are making decisions about your own body, my recommendation is that you meet with somebody as a healthcare practitioner who sits down and asks you very pertinent questions about yourself, your life, your health, in other areas and aspects besides just a thyroid or a hormone. And then you put together a comprehensive plan in order to ensure that you are balancing all the aspects of your life, not just hormones. I hope that helps answer that question, which was really a non-answer, but it's the most honest answer that I can give.